Dr. Robert Winningham, how are you doing? And welcome to Tuesdays with Mike.
No, I'm doing wonderful, and it's an honor to be here with you today, Mike.
Rob, we've been friends for a long time. We go way back. We're talking more than a quarter of a century right now. Talk to me just a little bit about your recollections of when we and how we first met. I've got some visions and memories encoded on that myself.
Yeah, well, I remember it was when you were working at Salem Hospital. I think you might have heard about a grand rounds that I did there, and somebody said, "Hey, you should check this guy out." And I remember you were really active in doing continuing education events back then, and
Mhm.
we worked together. And my most salient memory is you had I think you were inpatient, outpatient director of the hospital. But you had a really small office, and we would cram in there 6 a.m., 6:30 a.m. I remember thinking after 10 years of working with you and doing some really pretty amazing, productive things, we got all of our work done before 8 a.m.
That is exactly right. And your salient memories are quite accurate. I probably, hopefully, didn't mislead you. I never actually directed any programs, didn't have any people that I supervised, but I oversaw the continuum of care and helped patients move place to place and got a chance to see, intervene on a multidisciplinary level. And you're exactly right. You did the grand rounds at Salem Hospital, and my friend, an occupational therapist, Shannon Murphy Barlow, is the person that said, "I think you really need to talk with this guy." And wow, that was a wonderful introduction.
Well,
Yeah.
I owe Shannon a big thank you.
Yeah, yeah. So we work together and still do. We've taught many courses together, really all over the country. We've never gone in person internationally, but we've taught together in so many different states. And I learn from you every single time we teach together. Rob, you talk to therapists, doctors, activity directors, administrators, nurses, athletic trainers, personal trainers, caregivers, patients themselves. And one of the most amazing things that I find about you, and I know that we'll have for our listeners here today, is your ability to translate the complicated and make it practical. And those are some of the main things that I think I get from you, and I also give as a function of knowing you. So this is really what I'd like to guide us in today on that, and help us make complex topics really approachable.
That sounds great. I also learned a lot from you. There have been many trainings we've done. I sat in the back row just taking furious notes. So thank you.
Yeah. All right. Well, uh, let's start off with topic number one. What is gerontology, and how did you get into this? Let's talk about your background into where you are now.
Yeah, well, I started doing research on memory 35 years ago, human memory. I used to do research on eyewitness memory, false memory, things of that nature, and started focusing on older adults' memory about 30 years ago. And I think that, a lot of people don't know the distinction between geriatrics and gerontology. I think simply geriatrics is more, kind of in the medical context. And I think gerontology fits well in more of a biopsychosocial context.
Mhm.
About 15 years ago, I started a gerontology program here where I work at Western Oregon University as a professor. And so that's been a lot of fun. And we're able to, kind of bring in that biopsychosocial approach, but in a very applied way where our undergraduates are who graduate in gerontology are much more informed if they're going to work in senior living, advocacy, or in medicine.
Yeah, that's excellent. And I love that that broad umbrella that you're talking about, preparing people for really one of these life's professions, and potentially, as we know, the world is seemingly changing more rapidly than ever, preparing them for even fields that don't exist today. So, computer programming within artificial intelligence for assisting individuals to continue to age in place, for example. These types of things. We know that preparing people is part of what you do there at Western Oregon University. And let's talk just a little bit about what you see has changed with the science of what we think about aging. Let's even go back 15 years ago was one point in time you put an event timer in there. 35 years ago, you started studying memory. Rob, a question that I didn't necessarily think about asking you today is what has changed? Are there things that you thought were factual 35 years ago that you don't think are factual now in regard to aging?
Yeah, well, that's a great question. It has changed a lot over 35 years, and it's been so slow that sometimes it kind of I did one project where I had to retape some training videos for the senior living industry. I did that about a year ago, and it was 12 years since I had done them, and I was really surprised how much had changed. One of the things that has changed, particularly since 35 years ago or even 25 years ago, is the amount of evidence for the factors that affect brain health. I
Mhm.
remember in 2003, the first meta-analysis on physical exercise and brain health, memory, executive functioning. Art Kramer out of University of Illinois did a meta-analysis, and I think it's one of the first places that I ever saw it where it said it's not just aerobic training that can improve your memory and aging, it's strength training. And it popped on a meta-analysis. And I don't think anybody was really focused on that.
Mm.
That's an example of where now there's literally hundreds of studies have looked at the effects of strength training relative to aerobic training on cognitive and brain health outcomes. That would be one of them. The other one that has changed a lot, I did one of the first randomized controlled studies on cognitive stimulation training in a senior living context and published that in 2003. But it was actually difficult to write that paper because before that time, there were just mnemonic techniques, just memory tricks that you might learn at a business seminar or something like that. It wasn't focused, the previous research wasn't focused on going in, doing an intervention that could improve cognitive reserve or improve executive functioning. And so that's another one. And now, once again, literally hundreds of studies, randomized controlled studies have shown us how to do that, what works and what doesn't work. Another area of research, published a paper back in 2007 on the effects of really targeted social enhancement interventions in an
Mm.
assisted living environment led to decreases in depression and decreases in loneliness. That also was a very difficult paper to write because people weren't really talking about that, 20 years ago, where now it's a hot topic and
Yeah.
literally, families are making decisions based on those social outcomes that you'd expect in an environment like that. So I think a lot of things have changed. And then just to kind of sum it up, I probably shouldn't be surprised by this, but I am surprised about how incredibly multifactorial
Mm.
brain health is and the outcomes. And I don't want to start listing these because I'll use the rest of our time, but literally 20 factors and sometimes 20 interacting factors ultimately lead to brain health and quality of life later in life.
Yeah. You know what? I'm glad that you brought that up, and I may take you. I'm not going to say to task because I'm not going to ask you to list 20 and check boxes and say, Rob, you only came up with 18. You said there was 20. Here's exactly what I was mentioning just a few minutes ago. You just brought this into practicality. You just brought us 4 decades, three and a half actually, of uh, you know, of a timeline of how far we've come in translation. Because you said we used to train the function of the brain primarily in memory. We focused on that and we did it using strategies. And now we're changing the substrate because you said aerobic. Oh, but wait, resistance. Oh, but wait, social connectivity. So, Rob, if we put those three, and they're not going to be at the top of the list in terms of importance, and I'm not going to ask you to rank them in terms of importance, but let's understand that even though it's multifactorial and it seems like that could feel burdensome, that you have to control all of these, you and I are optimistic people, and we see that 20 factors that can be manipulated are just 20 opportunities. So take us through whatever 15, 17, or 21 more besides aerobic training, resistance training, and social connectivity that you think helps the substrate of brain health so that it can function better.
So, yeah, that's a great question, and kind of what you're saying there's 20 opportunities. There's 20
Yes.
opportunities because we're not talking about genetics. We're talking about lifestyle factors that people generally can control. So, it is a fair question. I'm glad I don't have to rank order them, but we do that in science. We talk about variance explained, and so, some of these, there's some data there where that could be done. I would just kind of blow up the physical a little bit more. I think we could talk about aerobic training and resistance training, but we also need to add in dual tasking now, something that
Okay.
you and I have spent a lot of time in the past decade working on and researching, doing a cognitive task and a physical task at the same time. But then I'm really amazed by the number of studies to the point where I only need to talk about meta-analyses on the effects of yoga on executive functioning and memory, the effects of Tai Chi on executive functioning and memory, the effects of meditation on executive functioning and memory. So now in each of those areas, there's 20 or more randomized controlled studies to do a meta-analysis, and they're finding that that
Mm-hmm.
helps.
Mm-hmm.
The other one is, and I know I've seen the variance explained on this one, is cognitive stimulation, just mental activity in your life. It could
Mm-hmm.
be organized into, a brain builders class. It could be how you live your life and the hobbies. That was estimated in an article published in the journal Neurology at 15%, 15% of the equation
Mm-hmm.
in terms of memory ability in older adulthood is related to that. So cognitive stimulation, a lot going on there. The social engagement that is cognitively stimulating. So now we got a cognition, social interaction we need to kind of account for. But
Mm-hmm.
the social engagement, but also avoiding loneliness, given the mental and physical consequences of loneliness. So another
Mm-hmm.
perspective
Right.
on that. And then just being mindful. I'm very mindful in some of these senior living settings that, we can do some amazing things from the social standpoint. We need to be mindful when those aren't happening. Another one is there's many different physical ailments that put people at risk for cognitive impairment. And so, some of the big ones to keep an eye out for, are diabetes that can wreak
Mm-hmm.
havoc on executive functioning, depression, anxiety. There's some other psychiatric conditions that put people at risk because so many psychiatric conditions are related to executive functioning, attention, and inhibition. And then
Mm-hmm.
there's a whole bunch of things we could talk about that I probably would want to count in a list of 20 other related to the person, their
Okay.
motivation. You and I have
Mm-hmm.
worked on self-efficacy a lot, making sure people know the benefits of, the interventions we're asking them to do. And then that leads to other things, which your podcast is probably doing, is helping increase health literacy. So people
Mm-hmm.
know they understand where we are with the science because it has changed so much over time, but why they should be doing all the things that they've
Mm-hmm.
heard that they're doing. So that kind of leads into the health literacy and motivation. So I don't know how
Wow.
many factors we hit there, but those would be some of the types of things I've been thinking about.
Right. And now I want to make certain that listeners are also hearing inside Dr. Winningham's attempts just to give a very concerted answer, because he's a person that thinks mightily about how he's coming across and does an exceptional job of it. He didn't want to go long winded, and he could talk about this for 7 hours. So let's pull out a couple of things in there, because when you said diabetes and lifestyle and etc., you're talking about nutrition, because somebody could say, well, wait a second, he didn't say nutrition, he didn't say diet. Well, it's in there. Um, Within these things of social connectivity, you mentioned two things on it. You said presence of social connection, because it can be cognitively stimulating to hear other people's stories. And you said also the dichotomy of the absence of loneliness there. So there's two major reasons why social connectivity is important, because it basically takes away a negative health attribute. It's like stopping smoking. So that brings me to two things that I didn't hear you mention that I know you can talk eloquently about, and that is environmental factors. So I brought up, obviously smoking, and we could talk about exposure to toxins and pollutants, etc. And now let's talk about sleep also.
Yeah.
So take a few moments, if you will, just to cover both of those. And I won't be, I won't elaborate too much more, just to say that we also know toxins can come through our intake and through our food, not just our environment. So whether that be ultra processed or the so on. So within those two, environmental and sleep, take as much time as you like and educate us accordingly.
Well, I feel like I need to kind of just jump off the nutrition really quickly as well.
Oh,
So
please.
yeah,
Yeah.
the diabetes is one. I'm not one that believes in a lot of these supplements that are being sold, and it's important for us who work with older adults to be up to speed on this, because it's just staggering the marketing campaign at many older adults for taking these supplements that are going to help prevent dementia. I think that the research there is really mixed. A couple of, the omega-3 fatty acids, I think the research is fairly solid there. That can help avoiding sugar. But there are some conditions where, particularly with vitamin B, I think we're pretty confident that some older adults lose the ability to absorb vitamin B,
Mm.
and that can lead to a couple of different types of dementias. So that's that just kind of a tee off of that. But I think, looking at the environment and sleep, you're absolutely right. The environment matters. You want to avoid smoking. But there's increasing research now on the effects of environmental pollution on
Hmm.
brain health. And I've seen that research. It seems to be most robust when you look at children who've been exposed to pollution or noise, actually, noise pollution too.
Okay.
And now with older adults. So now there's enough research out there to show that, living in, particularly in urban environments that have more environmental pollution, that does put us at increased risk to having cognitive
Hmm.
problems. So there's
Hmm.
that. There's also, that kind of made me think about stress as well. That would be
Wow.
another factor.
Sure.
And and stress is in the eye of the beholder. So I'd also put that kind of in the personality realm as
Yep.
well. We know that stress impairs our memory short term and long term through
Hmm.
different mechanisms,
Hmm.
and that the personality trait that best predicts dementia is, as we call it, neuroticism, but is prone to distress and worry. So people that just kind of live their life, kind of, looking at, the things that could go wrong, while that certainly probably had an environmental adaptiveness thousands of years ago, that
Hmm.
chronic stress or neuroticism does seem to
Yeah.
put people at increased risk for dementia, as does insomnia and
Hmm.
sleep apnea and other sleeping conditions. That puts us at increased risk, both short term and long term. I would say, once again, we see that just one night of poor sleep wreaks havoc on memory, executive functioning, but those long term effects can affect memory directly and indirectly through some other health consequences that can come with long-term sleep deprivation or working the graveyard shift,
Yeah.
such as depression.
Yeah. That's excellent. And I think you've really covered just a very comprehensive umbrella of what an individual can utilize, manipulate, if you will, in the framing of opportunities, things that you can do to improve your own brain health. We don't have to go back over those at all because, as we know, we want individuals to choose whatever opportunities feel most approachable, affordable, accessible, and also, you said it, Rob. You talked about health literacy. Whatever an individual believes is going to be the most powerful element. In fact, secondary to dopaminergic pathways, reward based pathways, placebo effect, if you will, that will likely have the greatest amount of effect based on the literacy that you've consumed and reflect within your own identity as well. Rob, you did a great job talking us through what we know about brain health. You're a researcher, you're an educator, you're a thinker, you're an influencer, you're a public speaker. What are things that you don't know about brain health that you want to know, that you're fascinated about, that you think are some breaking discoveries that we're close to? Take whatever one of those approaches you'd like to and expand accordingly.
Well, I'll kind of begin with something and it's related to a question that you had asked earlier about,
Mm,
what kind of surprised you. One
yeah.
thing that I've had to do in recent years, I've had to change my presentation of the results on alcohol in the
Oh,
brain. And I feel like there's more to learn there. There had been some, and I was really confident in these studies because they were large longitudinal studies that looked at the effects of many things, including alcohol, on brain health. And
mm,
and I maybe have a little bit of guilt. I mean, this is the way science works. It's self-correcting. But I have
sure.
told too many people about these studies that showed people that didn't drink at all were actually a little more likely to develop dementia than people that had 1 to 2 drinks some days a week. But certainly
Okay.
people that drank a lot were far more likely to get dementia. There's even a type
Mhm.
of dementia that's related to that called Korsakoff syndrome. And but the zeitgeist has changed, and even the our understanding of those longitudinal studies have changed. We now think that people in those studies, if they had had a chronic alcohol problem, but then stopped drinking, abstained for a long period of time, they called themselves non-drinkers.
Okay.
And they might
Okay.
have experienced some of those effects that lead to Korsakoff's. It's a vitamin B deficiency, actually.
Right.
Um, and so that's one that kind of surprised me. And so I thought I'd just take another opportunity to mea
Yeah.
culpa our field on that. That I think we got that one wrong, and people are
Hmm.
correcting it.
Yeah.
Moving forward, I think, and it's a little more, into the realm of medicine, but kind of understanding the etiology of dementia. Some of them are simpler in my mind. I feel like stroke is, second most common type of dementia, vascular dementia.
Right.
That's one I feel like we can understand pretty well, and we know a lot of the etiological factors there. But Alzheimer's disease, maybe even some of the other common types of dementia, dementia with Lewy bodies, Pick's disease, frontal temporals, that we still are not where I would have thought we would be in 2026 in terms of understanding these. My entire career, I remember writing a paper about this in graduate school in the 1990s. My entire career, we thought that there was this amyloid hypothesis that the
Yeah, you
amyloid.
would have thought that until 2024 also.
Right.
Yeah.
Yeah. And so and we have tried and we've tried mightily to try to reduce amyloid buildup in people's brains if they're at risk, not at risk, start them young, old. We've just tried everything over the past 30 years, and most of it hasn't worked. There was a drug that was recently approved, but it was controversial because the effect was not huge, but it did reduce the amyloid without causing serious side effects, which we saw in
Hmm.
earlier studies. But
Hmm.
still, I think that the people that study this the most, I believe the vast majority or nearly all of them would agree we're missing something. It
Yeah.
isn't just amyloid. The
Yeah.
amyloid is there, but it might be an artifact of other neurophysiological processes. So that, in my mind, is the big unknown. And that's important because I feel like we probably need to figure that out if we're going to develop an effective pharmaceutical or medical intervention to prevent Alzheimer's in people who are most at risk.
Right, right. Wow. It makes my mind go so many different directions when you bring this up. Because again, I'm familiar with some of the literature and I am not as deeply familiar as you would be. But when we think about, clear beta amyloid, it's like taking a statin to clear cholesterol. It'll actually take care of the problem of buildup and dementia. And even when the medication can clear it, and the function is not different, we know there's another mechanism in there. So now let's at least go one of these directions here, and let's understand. Okay, something we didn't talk about: will cold exposure significantly improve memory long term? Probably not. Maybe temporarily. What about heat exposure? Maybe. Well, hold on. There's individuals that have had a deep family history of dementia and also have significant amyloid buildup, but have worked in boiler rooms. One person with significant decades of heat exposure who didn't develop dementia. And then you could talk about all the other different life hacks out there. You mentioned supplements and etc. Let's talk just briefly about the dangers of fads, the dangers of profiteering on our fears about losing our executive functions. Do you have any thoughts about that?
Well, my first thought goes back to our earlier conversation. It's never as simple as people want it to be, and that's what I mean. I think that's the idea of multifactorial, conditions is many factors go into this, but many people want to focus on one thing
Yeah,
that's causing that. And I think the people that are selling these fads they're usually focusing on one thing. So that right away, just I think we should just be cautious of, even if everything that they're saying is true, it's one of many factors.
yeah,
So I think there's that on the fads. I think the fads are often try to make things easy for people. You just need to take this pill. There are things that we don't have a pill that can dramatically and permanently improve executive functioning and memory, but we do have interventions, and the various physical exercise and mindfulness training and cognitive training interventions, those will do it, but they don't come in the form of a pill.
yeah.
But there's one study that I find just really amazing. It was people who had mild cognitive impairment. If they had twice a week resistance training intervention, it actually led to an improvement in executive functioning and the ability to make a new memory twice a week, 20 to 30 minutes. We've been trying to develop a drug to do just that.
Yeah.
We don't have the drug that can do that, at least not permanently. There, a few drugs might get close, but this is what we're looking for,
Yeah.
and we have it in the answers. But they don't come in the form of a pill usually. They come in the form of hard work.
Uh, Rob, I have always high expectations for you. You've already exceeded my high expectations. You've got me excited about these things. And you put in the early portions of our conversation basically three items into a bucket of physical. And you talked about aerobic and you talked about resistance training. And I think largely people know how to do those things. Granted, there's some dosage and intensity factors and considerations of frequency. Let's put those to a side because they're a little bit more approachable and easily understood by people what they could do to get more physical activity in those realms. But you put one other thing into that bucket of things we can do physically. And I want you to take a moment or more than many moments to elaborate on dual tasking, if you will, because that also belongs, as you placed it, in things that we can do. Whatever you want to speak about here, activities, or defining dual tasking so people can understand it a little bit better, or just defining the mechanism of how it helps the brain? Rob, whatever direction or all three of those that you want to take, the platform's yours.
Thank you for that question, and please feel free to add in because we've been working on this together, and you have a really deep understanding of this, so it could be a good back and forth here. But as we've talked about in many contexts, dual tasking is different than multitasking. I think that's a good way to begin. Multitasking is usually doing two cognitive activities at the same time, which we can't do. We're probably doing alternating attention, alternating or task, alternating our attention between the tasks. With multitasking, dual tasking is doing two separate tasks that have separate goals. Often, and I think the easiest way to think about this is many of the examples are doing a physical and a cognitive at the same time.
Mm-hmm.
And I think those are a lot of the interventions that we have done where, you have a physical task you're trying to do. It might be something as simple as walking, navigating your environment while you do a cognitive task at the same time. And the nice thing about that is we can level it. We can make
Mm-hmm.
the physical task more challenging. We can make the cognitive task more challenging. And the nice thing about this is that we can measure it. We can see how much does your performance decrease when you do two tasks compared to do them doing individually. We call that the dual task cost. A really nice metric to see how we're doing in a lot of different contexts. We've been talking about, aging a lot here, but dual tasking has been shown to be effective in children, been shown to be effective for athletes, tactical warriors, and also older adults. So I think the dual tasking research is astounding. And the other thing that I'm really amazed by about this research is the number of conditions of aging that can be helped with dual tasking. So there's
Mm-hmm.
good evidence that Parkinson's disease, we can get improvements in executive functioning and cognitive abilities. After a stroke, some great research there. It's also really effective in and mild cognitive impairment, really effective there. Maybe one
Mm-hmm.
of the most effective interventions that we see in the literature is dual tasking for mild cognitive impairment. We also see that it's useful in testing. I'm amazed at the research. It's a little outside of my area of expertise, but I've read research on using dual task cost testing and seeing how people are doing in terms of a sport concussion or a mild traumatic brain injury. Very effective at seeing where somebody is and very effective at predicting future outcomes there. So that's been exciting. And now there's enough research behind this and enough attention that we're getting to the point where some of these dual task interventions are available to the end
Mm-hmm.
user. Mike, you and I, we helped set up a machine so they could do it just down the street from me at our local YMCA, so that it's effective there. But it can be done in schools, it can be done in senior living, and certainly can be done by physical, occupational, and speech therapists.
That's amazing. And I'm going to give you just one sideline, if you will, a part B to that I think really complements the wonderful answer that you have given to us. Why is dual tasking thought largely to be superior to just cognitive training alone? I mean, if I'm a scientist and I want to have an outcome in cognition, I would logically think that a cognitive intervention should be the strongest. However, and I'll let you fill in the blank.
Well, I would love to hear your forever, but there's two things. I mean, the simple one, and I think even just somebody listening to this might come up with this idea that, well, you're doing two things. You have a cognitive stimulation, intervention potentially, and you have a physical exercise intervention potentially. And some of that research, you have to be careful because you can't tell. It's really hard, like, to read these studies to tell if are they doing them at the same time or are they doing the
Mm,
programs in parallel. So I sometimes I really have to spend some time to try to understand what the study did. But
sure.
there's kind of this additive approach. But the other thing, this is goes back to the interactions. It's one thing to say that there's 20 factors here. The next part that's really hard to figure out is how these factors interact with each other. And I think that the physical exercise and the cognitive probably are interacting because we know that when somebody engages, and this is maybe some of the behind why the physical exercise interventions are so powerful, because we know that it leads to, well, neurogenesis, creation of new neurons in the hippocampus. It's probably
Mhm.
sexier than it is important, but we know that we grow more new neurons when we exercise more. But we also have greater synaptogenesis, or the greater connections between our existing neurons. We have greater angiogenesis and blood flow going in. And if we want to bring it down even more, many of these physical exercise interventions lead to brain-derived neurotrophic factors being produced.
Mhm.
It's to the point
Mhm.
where, and this isn't the research I follow, but I've seen some research showing different types of, physical interventions lead to different brain-derived neurotrophic factors. The one that sticks with me is just the importance of HIIT training, high intensity interval training, did some pretty amazing things. The genes that had been on when we were younger, they get turned off as we get older. Some of these physical exercise interventions turn them on. So that's where I think there might be an interaction. We do intensive physical exercise interventions, and it prepares the brain to benefit more from the cognitive interventions. So if you're getting greater synaptogenesis connections in your neurons, you're growing some new neurons in your hippocampus, you have greater blood flow, you have these brain-derived neurotrophic factors. Great. Your brain is in a wonderful condition to make some new connections, improve executive functioning, and your overall cognitive reserve.
Yeah. I would love to say something to capitulate and summarize and reflect. I need to add 0 words to what you've said. It's absolutely perfect. I love it. So, Rob, let's push just one more uh, area into the future now. All right, let's hope and wish and dream. Okay, and be as realistic as you want to be. Go 5, go 10 years from now, go 15 if you want to. What do you think that we might be able to know or change about the brain in 5 or 10 or 15 years from now that you're excited about? What are we going to know or be able to change?
Yeah, I I'm not 100% sure. I hope we understand the etiology of dementia better. I hope we can develop some pharmaceutical interventions, some things that are easier, things like that. But it's just taken us so long. That's not where I'm going to put my money. Where I think that there's a really good chance that we can evolve, and I think it's realistic, and I think AI could help us with this, is
Okay.
developing individualized prescriptions for people. And also I think just where we do that, I'm not sure which sort of professional bucket this goes in. I'm not sure
Right.
how insurance intersects with this, but I know that this is what people have been working on for a long time, and I think we are much closer. Even your former guest, Scott Fulton, was on. I think some of his thinking in terms of the various factors, the interactions of those factors, can lead to some individualized prescriptions. I would love to see us get to the point where we could do a series of tests and surveys, maybe some physical exercise tests, and to come up
Mm,
with a prescription for what we're talking about here. What type of physical exercise would benefit you more? What types of, even the dietary supplements, on some of this, I think there's some things we could see some deficiencies there that we'd want to change. Or some, we might see, a cholesterol problem that we might want to address, high blood pressure, things like that, of
mhm,
course,
mhm,
stuff. But then also looking at the social aspect of this as well, where can we improve? The cognitive aspects of this, what sort of, in terms of your physical health, your mental health, and where your goals are, what you want to do in the future. That also I think
Mm,
could be thrown in there. And I think that would be exciting if we find an accessible way to kind of get a brain health prescription and
yeah.
then the information and support to kind of put that new plan into place.
Yeah. You know what's most beautiful about that, Rob, is that your aspirations for the future remain very grounded to the person that you've always been and you continue to be, is that you want the progress and you want the developments to be utilized on a person-specific basis. And you started off with saying what we've got to do is, and you didn't contradict yourself. You said, what we've got to do is we've got to figure out what each person needs so that across those 20 factors, that I'm not saying everybody has to do something about every single one of them, but we pull the levers for this individual that's going to provide the greatest return on intellect, a different ROI, if you will, or on their brain health, because ultimately, you're right. It's the interaction of these factors. You can't say 9 hours of sleep and your brain will be totally fine. You'll never get dementia. Well, control for that as best you can. Eat this diet and you'll never get. Do this exercise and you'll never get. Eat this supplement and you'll never get. We know that it comes down to interactions. And what you just shared with us right there was resonant and consistent with every single through line that you've given to us, is that we've got to make certain that we are getting to a place where we can do a screening tool so that we can give an individualized prescription for this person. And yes, benefit from the full umbrella of things that we know that can make a difference, but we make those interventions according to what this person needs. Brilliant answer. And as I always expect from you, very evidence based and very grounded. Rob Winningham, you have amazed us here on Tuesdays with Mike. You brought exceptional knowledge. Anything that you would like listeners to know as we wrap up? That can be where to find you, courses that you teach that are available, how to contact you if they want to bring you in as a motivational, educational, health literacy teacher, corporate healthcare, or active living. What would you like to share with us, with the audience?
Well, first of all, thank you so much for the kind words. It's been such a pleasure to chat with you, Mike. Um, a few things that I would say. So, I think the book that would be most relevant for people that want to take advantage of some of the cognitive stimulation work that's been done. We have a book called Cranium Crunches. I published this with Activity Connection. We're coming out with a new volume any day now. I thought it would be out by now, but we
Oh,
have
wow.
coming out the second volume of Cranium Crunches. And
Nice.
the nice thing about that is I actually put together several executive functioning pre-test and post-test. It's really appropriate for people that older adults that are beginning to show some signs of cognitive impairment and just want to do everything they can. So that's a good product. The other thing that I said, I love having these conversations. So if any of your listeners want to have me come, and it's so easy to do this on Zoom. I do like to travel, but I know it's easy to do it on Zoom to talk about this. It's important, I think, for just in the work world to learn about this. It's also important to kind of bring in the psychology and brain health work into the world of therapy, and I think that's why you and I have been so productive working together. And people can reach out to me. LinkedIn is a great way to find me and stay in contact. But my email is really easy to remember. Just my name, Rob Winningham, Winningham, @gmail.com.
Excellent. So I'll drop one last thing that I just remembered as you were giving your email. Again, robwinningham at gmail.com. Decades ago, and I may have this incorrect, I used to think that a person needed to be invited to have a Gmail account. We're talking two and a half, nearly 3 decades ago. You had a Gmail account before I did, and I only got one at your suggestion. So that's another little interesting tie that we have right there. Yeah.
Yeah, that's great. The other thing that I would say is for both of us, for Mike and I, if you want more of this information, I mean, go to MedBridge, particularly for the physical occupational speech nurses. We've got some great courses there.
Yeah, thanks for plugging that as well. Rob Winningham, Dr. Rob, thank you so much for joining Tuesdays with Mike. It's been a pleasure having you, but not as much as a pleasure it should be for the listeners to benefit from what you've bestowed upon us. Thank you so much.
Oh, thank you.